My name is Kristen Hami. I developed macular degeneration at age 30, and had I known then what I know now, I believe I could have prevented the loss of my central vision. This slide lecture describes a common sense approach to controlling macular degeneration. This video is presented in two parts, overview and treatment. This is part 1, overview. Here's the bottom line of this slide lecture. You can prevent and treat macular degeneration with diet. The micronutrients in which you're probably deficient, despite your current healthy diet, are vitamin A and zinc. So that's what this slide lecture is about. So, what is a healthy diet? A healthy diet includes ample fresh vegetables, of course, and adequate protein, but it also includes substantial amounts of true vitamin A, which is found in the fat of fish and animal liver. The other sources of true vitamin A are insignificant compared to liver oil. And zinc, which is also found in liver, plus meat in general. This, by the way, is the essence of the caveman diet. Macular degeneration is a chronic eye disease in which the central retina gradually deteriorates, causing a blind spot in the center of the visual field. Wet macular degeneration is an aggressive form in which new blood vessels grow and leak under the macula, causing rapid loss of central vision. Dry macular degeneration is believed to be caused by an accumulation of metabolic waste products in the delicate metabolically active center of the retina. Wet macular degeneration is believed to be caused by hypoxia, that is, low oxygen, via impaired circulation. Impaired circulation may be caused by damage to blood vessels and/or by sticky immune cells clogging tiny capillaries. This image shows the visual field after macular degeneration has run its course. The patient remains ambulatory and doesn't need a white cane, but the detail vision is lost. So vision loss is generally limited to the macula, the very center, due to its uniquely high metabolic rate and its high oxygen demand, with its low vascularization or blood supply, which is due to the tight packing of nerve cells needed for detail vision. With loss of central vision, patients lose the ability to drive, but with visual aids, patients can still do most things, albeit more slowly. Gainful employment may be difficult due to slower productivity. The prognosis for macular degeneration, especially the wet form, is not good. Since macular degeneration is a chronic metabolic and/or immune condition, it will progress until the cellular imbalances are corrected. These cellular imbalances include insufficient oxygen or hypoxia, too much oxidative damage, too little repair, and too much inflammation or immune activation. In other words, macular degeneration is a localized manifestation of a systemic problem involving poor circulation, high oxidative stress, and/or a pro-inflammatory hyperimmune state. It is often associated with heart disease, poor digestion, and disturbed gut flora, which can reduce absorption of important micronutrients, and poor liver function. Conventional medicine has finally begun to address micronutrients. There are many supplement formulas, most of which are based on vitamin A and zinc, but the particular forms of these micronutrients and their other ingredients may not be optimal, as we'll see. Conventional treatment also includes anti-angiogenesis drugs. Angiogenesis means new blood vessels, given as injections. These drugs interfere with new blood vessel growth by blocking an enzyme called vascular endothelial growth factor. Finally, conventional treatment may use laser photocoagulation, which targets new blood vessels for destruction. The patient receives an injection of a photoactive drug that accumulates at the new leaky blood vessels and is activated by the laser light such that only that tissue is killed. And briefly, here are the flaws with the conventional treatments. Regarding the micronutrient formulas with vitamin A and zinc, they are a nice beginning and they may help some relatively healthy people, but many of these formulas fail to use the best forms of these key micronutrients. The forms they use don't work for everyone. And many formulas include copper, an angiogenesis agent. That means it facilitates blood vessel growth. It's shocking. Regarding the anti-angiogenesis drugs to suppress new blood vessel growth, the outlook is promising. They do address the biochemical mechanism, and they do appear to stop new blood vessel growth. But these powerful pharmaceuticals can have side effects, and they have a hefty price tag, and you must keep taking the injections monthly. Regarding laser photocoagulation to kill new blood vessels, it appears to slow progression in the short term but not the long term, and since it does destroy retinal tissue, it can only be used in small off-center spots. And none of these methods address the fundamental chronic imbalance in your systemic cellular metabolism and immunity. Back to conventional micronutrient formulas. For vitamin A, many use beta-carotene or mixed carotenoids, which are unreliable precursors, instead of true vitamin A. True vitamin A is an oily molecule which can exist as retinol, retinil, retinal, or retinoic acid. The carotenoid precursors can be converted to vitamin A only with a healthy and energetic liver, and if you've got macular degeneration, your liver is already working overtime. Whereas if you're healthy enough to convert carotenoids to vitamin A, you probably don't have macular degeneration. So why do they use this fake vitamin A instead of true vitamin A? We'll get to that in a minute. Second point, many supplement formulas use too low a dose of vitamin A. Now what's wrong with zinc in supplement formulas? Many use the poorly absorbed zinc oxide form instead of the better absorbed chelate form. A chelate is a cage of easily absorbed molecules that surrounds the molecule of interest. What else? Many supplement formulas use too low a dose of zinc, and we'll get to this in a minute. So here's the summary. The key to treating macular degeneration is essentially these two micronutrients. Vitamin A, use the true form, retinol, retinal, retinil, retinoic acid, in high but safe doses. Zinc, use a well-absorbed form, also in high but safe doses. For more detail, let's go on to part 2.